Okay, in this video I want to show you how to test for liver disease, kidney failure, kidney disease, heart failure, and heart disease, and urinary tract infection, along with several other health issues that someone can acquire. And this video is going to, first we're going to go ahead and demonstrate how to do it. Like I said in the title, you could do it from home. It's very easy to do, very cheap to do, and then we'll go ahead and demonstrate how to do it, and then we'll go to the computer, and then we'll talk about the results. All right, I went ahead and collected my urine. I recommend I went ahead and did it. You can get it a little plastic cup or whatever, and you want to make sure when you collect it that you do it. Like just during the day or whatever. Don't do it after you've drunk a whole bunch of water or whatever, because it'll dilute the results. So, whenever normally you would go to the bathroom, that would be when to check it. And also, too, I'd recommend to check it a few times over maybe a week period, maybe once a day over 5 days. That way you can get more of a realistic result of what's going on, because, something... You can have an elevated level in one of these particular categories, and it might not be completely accurate. All right, so what it is you can get these little take-home urine tests, and I'll put a link in the description. You can get them anywhere, eBay, Amazon. I'll send a link at the cheapest place that I've found that you can get it. And again, it's not an expensive test. We're talking... $20, $30 at the very most, but it's probably even a little less than that. I don't think that you can get it at most drugstores. I've checked Walgreens and CVS. There might be one that'll test one particular level, like your pH or your glucose, but what you want is a comprehensive test. And so we'll go ahead and test it. What you do is you get the strip, and this particular one, I got this one on Amazon, and it comes with 5 little urine test strips, and each one of these colors will measure a different area. And the different areas that it will test is like leukocyte, nitrate, pH, blood, specificity, density, and a few others. But again, we'll go to after we get the results, we'll go to the computer and we'll examine each one of them. All right, so I have my urine here. And so what you want to do is you want to dip it in the strip into the urine for about 5 to 10 seconds. Make sure it's covering all the little pads there. Okay, and then we want to take the rest off. And then what you're going to do is you're going to sit and you're going to wait. You're going to wait 60 seconds. And then it comes with this little graph that's going to show you on the left here. It's going to show you what it's supposed to be, which means it's negative, which that's a good thing. The higher it goes to the right, the more abnormal it is. Alright, so it's been close to 60 seconds. And as you can see, you want your color to match up with the color on the very far left. So the first row is leukocyte, and as you can see, those two colors are pretty close. The nitrate, mine looks a little bit discolored, and the more stronger it gets, like this is solid purple right here on the second row, and mine is not completely pale like it should be, so my nitrate levels is elevated. Third level, a little bit elevated. Proteins in urine, that would be the fourth one right there. That actually looks pretty good. pH looks good. What's that third one called? Blood is good. Now the specificity density is not as good. Okay, and that could be a result of heart failure, which I know I don't have because I just went to the doctor, but see, mine's real pale, and the more levels of chemicals that you have in your urine means more of an issue. Okay, the next one's ketones, which measures burning fat. Okay, then the second to last looks good, and the glucose level that shows diabetes is good. Again, yeah, this test will actually test you for diabetes. All right, so now let's go to the computer and we'll examine each one of them. Okay, so we just took the test, the urine test, and now we're going to discuss. We're going to go over the different areas that it tests and what that would be a symptom of. All right, so the first one here, which mine was actually normal, is called leukocyte, and what that is, it means you got white blood cells in your urine. That can mean infection in your body, kidney infection, So that one, don't worry about that one if yours is elevated. It's usually something that's less problematic. Second one we got here, this is if you got nitrate in your urine, and that's usually a sign of urinary tract infection. Again, that one's not too concerning. The third one is it's called Urobilinogen. It's the breakdown of bilirubin, and what that is an indicator of is could be an issue with your liver. It could mean you have cirrhosis of the liver, which could be caused by many things, hepatitis or alcoholism, and so it might be a symptom of hepatitis, cirrhosis, and what that is, it's basically the flow of bile, the flow of the bile from your gallbladder could be blocked as well, and that could be a symptom of that. So that one could test for your liver functioning. Okay, and now your fourth row is protein, and what protein does is basically your kidneys aren't filtering out the protein out of your blood, and you're basically secreting protein out of your kidneys, and that could be a symptom of chronic kidney disease, kidney infection, diabetes. So an increased amount of protein would mean that. It could also mean that you're pregnant or you got lupus. So that's one thing to be to concentrate on. I think mine was normal. The protein level of mine was normal. And as you can see here, the far left is negative. That's where you want your color to be on your strip. Okay, and as we discussed here, this shows you what the strips look like with the different colors. And so you want it to be on the far left. The further right it goes, it means there's an elevated amount of whatever it is in your urine. All right. The next one would be pH. Right here, you want it to be 5, and that could mean kidney disease. All right, and if it's elevated, if it goes all the way up to 8.5, could be an indication. Mine was what was mine? Mine was pretty good. Mine was around 6. Mine was right there. All right, next one is blood. If you got blood in your urine, that's not a good thing, and that could be an indicator of kidney disease, urinary tract infection. It could actually be an indicator of cancer. So, you wanna, if you got blood in your urine, you definitely want to get that checked. The next one is it's called urine specific gravity, and that means that you got chemicals, an abundance of chemical particles in your urine, and that's the one that you want to look for as far as heart disease, heart failure. That's the main one right there. And mine was definitely elevated. Mine was at the highest level. Mine's way up here, which is not a good thing. I recently had a physical. I went to the cardiologist. I had a echogram done where they look at your heart and everything looked good. So I'm not exactly sure why mine's so elevated. It could just mean that I have heart disease. It's probably a good chance of it. So again, you want yours to be 1,000. You want yours to be blue. Okay, the next one here is ketones. And ketones is a breakdown of fat to make energy. What happens is if you're not having a supply of sugar in your blood, what'll happen is you'll start burning fat, and you'll I'm sure you're aware of the diet called the Atkins diet, and basically what the Atkins diet does, and a lot of the where you're eating all meat, very little carbs, you are going into ketosis, and that's debatable whether that's a good thing or not to burn fat. Some people swear by it. Some doctors swear by it. I have seen documentation and studies where actually people on the Atkins diet, where they're eating nothing but meat, their cholesterol goes down, but they find that it suppresses your appetite. You don't eat as much though, and that's what's funny about it. People think that those on the Atkins diet, they're overeating. They actually find it suppresses your appetite when you're eating, nothing but protein and no carbs. Again, I don't recommend that. I'm not a doctor, so I'm just telling you what the studies find. And again, if your ketones is elevated, that's really nothing to be alarmed about. It can mean that you're fasting or you haven't eaten in a while. Okay, the next one is called bilirubin test, and what that'll do is that'll test for liver damage and red cell breakdown. Basically, what it is your liver's not doing its job. It's not breaking down it's not absorbing the red cells. So mine was over here at the where it should be. If it comes over here, it should be something to check out. All right, the final one, last but not least, is glucose. And as we discussed about the ketones, the glucose measures what sugar is in your is in your urine. And if you got too much sugar, it's secreting into your urine. It means that your kidneys aren't filtering your sugar, and that is the foretell sign of diabetes. So and mine was normal, and my physical that I had showed that I didn't have diabetes. So that's one that you want to definitely go to the doctor if you got elevated glucose. And so this test, I'll put a link in the description of where you can buy them. You can look it up and compare prices and all that good stuff. But it's not an expensive test. Even if it comes from Europe, that's where I bought my test from. You'll get it within a couple of weeks, if not that, and you could test at home. A couple of things. We'll talk about other symptoms here real quick when it comes to liver failure, kidney failure, heart failure. For heart failure, some of the symptoms that you may have, shortness of breath, and where you can't catch your breath. Literally, you might be sitting down and you cannot breathe, and you have to actually stand up, and it's a very, very scary feeling. I'd recommend going to the ER if you get really bad shortness of breath. Another one here is fatigue, weakness. Another telltale sign is swelling, edema in your legs, your feet, your ankles, even sometimes your hands and your face will start swelling, and that basically means that your body, your heart is not able to keep up with the pumping out blood. So what will happen is you'll get leakage, and that'll go down to your feet and your legs. Now that could be also a symptom of your veins was not being efficient enough. I think it's called venous insufficiency is what it's called. So if your feet do swell, don't be alarmed that you have heart failure. Of course, get it checked out, all that good stuff. Go to the doctor. But I had really bad feet swelling. I have a video. Actually, I could link you up there, but it's on this channel where my feet were really bad swollen, and it turned out to be, I think my veins or something, and I'm overweight. All right, rapid irregular heartbeat. That's if your heartbeat is going from 60, and then within 5 minutes it might go to 100 without exercise. Then it goes back down to 60 to 80. Persistent cough or wheezing. If you don't have a cold, but you can't get rid of a chronic cough, that could mean that's build up into, just like your legs, it could be building up into your chest where you're coughing and you got fluid in your lungs. Increased need to urinate at night, swelling of your abdominal, sudden weight gain from fluid retention, lack of appetite, difficult concentrating, shortness of breath. We talked about chest pain. That could, if you have heart failure, it could be a cause of a heart attack. All right, the next one we'll talk about is liver failure. What's the symptoms of liver failure? Nausea, loss of appetite. The big telltale signs is if you got jaundice, if your eyes are yellowing, or if you got yellow tint to your skin, your abdominal, your stomach will start swelling. If you bleed easy, if you bruise easy, it can be a symptom of liver problems. Mental disorientation, where you have forgetfulness. Sleepiness, where you're sleeping all the time. Or if you go into a coma, that could be symptoms of liver failure. Acute kidney failure, that could be decreased urine output, like if you have to wake up in the middle of the night and you got to go pee several times. If you got to go 3-4 times, could be a symptom of kidney failure. Fluid retention, in your legs, just like your heart could do. Shortness of breath, fatigue, confusion, nausea, seizure, chest pain, pressure. Those are all symptoms of acute kidney failure. All these symptoms sound scary. You might have several of these symptoms. If you are, for whatever reason, if you're watching this video and you run into my video because you're checking on your symptoms, and you're scared to death that you got kidney failure, you're scared you got liver failure, you haven't been taking care of your body, you're overweight, you haven't been exercising, you've been eating junk food, you've been drinking your whole life, you've been smoking. Okay, the body is very, very tough, and it's very strong, and it's got a great ability to heal itself. And I'm not going to sit here and lecture you. I'm just basically wanting to put you at ease, not to panic and not to think of the worst situation. Because when you go on Google and you start looking for symptoms, everything will fit you, and that's what I've noticed about myself. Several years ago I just knew for sure that I had kidney failure, and that, of course, it wasn't true. And then here recently in the last year, I just knew I had heart failure. I had swelling in my feet. I had shortness of breath. I mean, really bad shortness of breath. I had chest pain. I had a dry cough that wouldn't go away for like 2-3 months. So I knew I had heart failure in my mind. And then immediately I went on Obamacare, got health insurance. I'm in the United States, and I had tests done, had an EKG, echogram, stress test, all that stuff, and it turned out my heart was fine. I had it's called a bicuspid aortic valve. I don't know if that has anything to do with my symptoms of swelling, but again, I still need to lose weight. I still need to take better care of myself, all that good stuff. But what I'm telling you is the worst thing that could happen is that you're worrying to death about it, and you start worrying about your life and your family that you won't be around. Just go to the doctor. If you're in the if you're in other countries, usually you have health care. If you're in the United States and you don't have health insurance, get health insurance. Go through Obamacare. I did, and that starts like November, December, January, February is when you can get it. If you're in the middle of the year and you can't get it and the time's elapsed, go to the doctor anyway and just tell them your situation. And in the United States, there's plenty of plans, plenty of things that can help you with the financing of it. But your health is the most important thing. And the greatest thing is to set your mind at ease. And when you have all these symptoms, if you stop worrying about yourself, and a lot of times that worrying and that anxiety will actually bring on some of the symptoms. So just stop worrying about yourself. Go to the doctor, and they'll do a thorough blood test, a thorough urine test, and that'll be, that's not that expensive, and that'll show if for any reason you take this take-home test and any of these levels are elevated, or you have several that are elevated. Again, don't be alarmed. It's not, this is a urine test. It's not a blood test, and it's not one of the more sophisticated tests that doctors have. But don't be alarmed if you do. Just go to the doctor and do what we discussed. All right, thanks for watching, and if you have any questions, put it in the comment section. If there's any way that I can help, let me know. Thanks.